Hi, this is Amy Deacon, and I'll be giving the last lecture in the first module of the Path Elective Autopsy series titled Writing of Stellar First Autopsy Report. There are many tips included here in order to help you create a complete and well-documented autopsy report. You will find throughout your pathology training that there are many opinions about how to write reports, but hopefully this will be a great foundation for you to build upon in the future. The objectives are to cover important concepts regarding documentation of findings in an autopsy and include important general rules to follow when writing reports. Lastly, I will cover some of the tips and tricks to avoid the most common pitfalls that I encounter when editing reports written by new resident pathologists. The autopsy is considered a medical examination, and just like a clinical examination, requires accurate and thorough documentation of the procedures performed, dissections completed, and information gathered during the case. Frequently, during clinical rotations, people like to say, if it's not documented, then you didn't do it. Well, the same is true in pathology. Likely during your orientation to pathology residency, the director of the autopsy service will give you detailed information about how reports are to be written on their service and what format you are to use. It is best to follow the format preferred in your individual program, but most reports include all of the information that we will cover today in some way or form. During the procedure, the most common way to document findings include shorthand notes, drawings, and annotations on body diagrams. You may be expected to keep written notes. However, some programs may use a dictation platform similar to when you are grossing. These notes usually include important details that are difficult to remember, such as organ weights, measurements, and specific lesions which are identified during the autopsy. Body diagrams are important in the external examination. They help you track the laterality of the lesions that are observed, and the exact location can be drawn on the diagram. I frequently draw and annotate on diagrams such as these. These shorthand notes are then transcribed into verbal descriptions in the final report. Photographic documentation has become increasingly more important and more common with easy access to digital photography. Autopsy photos can be used as evidence in court for both criminal trials and forensic cases and medical malpractice cases that you may see on your hospital autopsy service. It is very important to include the date and time of the photo. We do this by setting our camera to watermark the date onto the photo automatically. Include the name and case ID number. You can do this by taking a label with the name and case ID number and including it prominently within the photo. And to include a size reference for court documentation. Ideally, you would use one that has both an X and Y axis. This is an example detailing a bullet casing showing an X and Y dimensional scale, which is commonly available in forensic settings. Not all hospitals have these types of scales, but I frequently use a ruler, which can also be prominently displayed in the photo to give the observer an idea of the reference of size. Photos that are important to take during the autopsy, especially in the external exam, are photos which demonstrate features of identification so that family members could identify the patient or the body from these photographs. This would include an overall generalized wide-angle view, which is an overall body survey, which shows the anterior and the posterior aspects of the patient. You want to do close-up photos of tattoos, piercing, and jewelry, which may be used for identification, as well as the name ID and medical alert bracelets, which come with the patient. In a forensic case, you would want to document evidence of injury and photograph all injuries that you identify. In a medical case, you would want to take note of the evidence of medical therapy. This would include if there are dressings which have documentation, such as ID initials of the person who changed the dressing and date when the dressing was last changed. You want to photograph the dressing, then remove the dressing and photograph again what's underneath it. Finally, you want to demonstrate any gross pathologic lesions that are identified either on the external or internal exam by photographing them thoroughly. Postmortem photography is important, and you want to include documentation in the report. You always want to state if postmortem photography was acquired. If it was acquired, you want to include the storage location of that information, including the file pathway, so that it's easy to retrieve the photos within your documentation. If you leave the institution, someone else may need to follow your footsteps and be able to retrieve these photos for attorneys or for court if necessary. There are two general styles that are used when writing an autopsy report. There's the freestyle and the templated format. Most teaching programs use some type of templated format. This is useful to beginners to ensure that you don't miss important items. However, it can create some pitfalls, which I'll discuss later on. In the templated format, they have descriptions of normal findings, and there are blanks to add information such as organ weights and measurements. Some experienced pathologists use a freestyle report, which is similar to a descriptive or narrative essay. This lends itself to the most accurate reporting of findings, however, can sometimes result in missing information because it relies on your individual memory to include all the pertinent details. The overall approach to writing an autopsy report. It is very important in general to separate opinion versus facts by clearly stating which information is your opinion and which information is factual. You want to stay current on all of your reports that you're writing. Residents are frequently required to be responsible for multiple reports which are in multiple stages of being completed. So you want to write each part as it is completed so that you avoid forgetting information or incorrect recollection or mixing cases up. You want to document all findings as completely and accurately as possible at the time that you are performing an examination. The sections that we include in our autopsy report include the final diagnosis summary, the cause of death opinion, clinical pathologic correlation, microscopic examination, gross description, which includes both the external and internal components, the block summary, which describes all of the slides that you have taken and where they're coming from, ancillary testing, so anything like culture results or postmortem vitreous chemistries or toxicology, the clinical summary and case history. The final diagnosis summary should include all findings from the gross, microscopic, and ancillary testing summarized for the reader. Common pitfalls that I see here in this section include forgetting to include the microscopic diagnosis. Frequently, you'll write the gross diagnosis first and then go back and add the microscopic diagnosis, so sometimes people forget to add all of the microscopic findings. Also forgetting to include the status if there are other pending results, such as the neuropath exam or other ancillary testing which has been sent out, such as toxicology, if you're not going to pen the report waiting for those results. And not checking for discrepancies with other areas of the report. So in the final diagnosis summary, if you state there is cardiomegaly and the heart weighs 650 grams, also in the gross description, the heart weight should also read 650 grams. Any place where there is an area for discrepancy where things don't match, it can become a problem. The cause of death statement, which is one of the most important parts of the report. In this statement, there's a way to phrase it and form it that I feel is very important. You want to include that this is your opinion as the pathologist of record. So the cause of death is an opinion, not a fact. The evidence on which your opinion is based, so which facts that you discovered and determined during the autopsy, as well as the clinical history that are going to support your opinion. And then also include a statement that your opinion is generated with all the facts that you have available to you at this moment in time. Occasionally, and especially in forensic cases, additional information that is not available at the time of the writing of the autopsy report comes forward later, and you may want to amend or change your opinion based on this new information. And so you always want to be upfront that the report is generated with the information available at that particular time. The clinical pathologic correlation is something that you will learn to write during residency. This is a narrative summary of the pertinent findings of the report, which is frequently included in autopsy reports generated by a hospital. This satisfies the College of American Pathologists inspection requirement for using the autopsy as an educational purpose. This is a specific numbered item in the anatomic pathology checklist. The purpose of it is to correlate autopsy findings with the patient's clinical course and educate clinicians using the autopsy as an educational tool. Can sometimes be problematic in medical legal cases. So in some cases where I am concerned about medical legal aspects, I may omit this section from the report, and it is not included in most forensic reports. The microscopic examination is the section that comes next in our reports. Overall, there are two general approaches to writing this section of the report. There's either the slide-by-slide technique or the organ-by-organ technique. So some autopsy reports take the microscopic sections and list findings based on each and every slide. Other reports, this is the technique I favor, which is to write it organ by organ. So you may have 4 to 5 slides from the lungs, and you may have 3 slides from the heart. And so each section would summarize all of the findings from those specific slides from that specific organ system in one paragraph. The gross description is usually broken up into 2 sections. You usually have the external and the internal examination. The external examination will include everything that you documented on your body diagram at the time of the autopsy and that you photographed on the external surface. The internal exam is the summary of the findings within the internal organs. The clinical summary usually includes a short summary of the admission course or the circumstances surrounding the death, which could be obtained from the chart or in a forensic case maybe obtained from the investigation. When creating this summary, it is important to identify what is fact and opinion of the reporting entity where you obtain the information. Be especially careful to refrain from judgmental statements about the care provided to the patient. And be sure to document who is providing this information that you are including that could be controversial. Is the information provided by the investigator, by the EMS, by the family, by the medical record? So in autopsy reports, the most important thing to include is really all of the findings that you're seeing. So these are the things that we're looking for. And so when we find problems, I'm going to list some of the tips and tricks and pitfalls. So one of the most important things to recognize, obviously, words mean things, and we need to choose our words carefully and deliberately to communicate what we want to communicate. As you can see here in the photo, the 2 sets of lungs here appear very different. One set, the set on the left, appears pink and healthy. The set on the right appears not so healthy. So we want to make sure that we're communicating exactly what we're seeing verbally. And so sometimes that takes a lot of practice. As I said previously, most teaching programs will provide you with a templated report of how they would like the report to be written, and that is best to follow while in training. However, if you are not provided with a very specific template and you are looking for something to follow, to be sure that you have included all of the pertinent information in your report, the CAP Autopsy Committee has one available on their website. So if you need to use a templated report or you don't have one, you can access a templated report at the CAP website. Like I said, careful word choices are important. When you describe jewelry that is included with the body, you want to always use very descriptive words. So you want to say something such as clear colored stone in a silver colored solitaire setting, not a diamond engagement ring. You are not a jeweler. You are not an expert in jewelry. You do not know if this is a diamond or if this is not. So you want to be very clear that you're very descriptive as to what is present, but you do not want to make assumptions as to what it is. When you describe evidence of medical therapy, do not use brand names. Do not say Foley catheter. Use the term urinary catheter. Do you purchase the catheters through your hospital? Do you know that you use Foley brand catheters? You don't. So you always want to use a generalized term, not a brand name. So something like a Foley is like a Kleenex. It is a brand name for a tissue. Do not use accepted medical jargon or abbreviations, especially in the clinical summary. Do not say coded. Do not say things like that. The only acceptable abbreviations are really for units of measurement, such as centimeters or milliliters. Always weigh your organs, or if you cannot weigh them, you want to document things in 3 dimensions if possible. My approach to writing these reports is to use medical diagnosis and terminology exclusively. There are some people who advocate for reports to include family/layperson type jargon, so the reports are more understandable. However, these are reports that are entered into the medical record and sometimes used in court proceedings, so I personally prefer that they use accurate medical terminology. I am always happy to explain these to families if they call and have questions. Some institutions do include a medical or include a layperson summary, and where things are explained in a more common language. So that's also an acceptable thing to do. But the general report, in my opinion, should utilize medical technology and medical diagnosis, or medical terminology and medical diagnosis. So you want to be sure that that's what you're using when you're describing things. So examples would be, please say pleural or pericardial effusion or ascites, not cavity fluid. Splenomegaly, not big spleen. Thrombus, embolus, not blood clot. Aneurysm, not dilated big artery. Ecchymosis, contusion, hematoma, not bruising. Ribs, sternal fractures, not broken ribs, sternum. So these are just examples of things I've seen used, words that people have put on reports for me. So please be very descriptive and also use your medical terminology, please. One of my personal pet peeves when you're describing coronary arteries, stenosis is the abnormal narrowing of a passageway in the body, whereas occlusion is something that blocks a tube or opening in the body. So when you're saying something is stenotic, there is still some lumen present. So if you're going to describe your coronary arteries, you want to say stenosis, 50% stenosis. But if it's occluded, it is completely blocked off. So if you're going to use the term occlusion, make sure that there is a complete blockage in the artery. As you get more experience in pathology, one of the most important things to do is to figure out how to practice describing objects in great detail. You want to include all the important parts of the description. So you want to say who, what, why, when, where. These are all the things that you need to include. Who, what are you describing? The left lung. It's comprised of 2 lobes. You want to describe the bronchial mucosa, any lesion in the bronchial mucosa. Parenchyma, what the cut surface of the parenchyma is, what it feels like. The bronchi are unremarkable bilaterally. The parenchyma is yellow-tan consolidated with a large 3.2 centimeter mass. It's friable. It shows whitish, exudes yellow caseating material from the center. The remaining parenchyma of the upper lobe can also describe the rest of the lung. So you're describing one lesion, but describe what the rest of the lung looks like. The remaining parenchyma of the upper lobe shows dense consolidation and hepatization. Where is it? Whenever you find a lesion, you need to say where it is exactly. So the person has an idea in 3-dimensional space what you're looking at, the same as you when you're describing it. So this lesion, it's 2.5 centimeters from the carina involving the left upper lobe. Why? Why did you see it there? Why were you looking for it there? Pre-mortem radiography detailed that the patient had a partially cystic and solid mass in the upper lobe. How? How did you find out what this is? So we cut the lung. It showed caseating material, which was collected via needle aspiration, sent for anaerobic and AFB and fungal cultures. So we need to be very detailed in describing what we're doing, why we're doing it, how we're doing it, what we're seeing, where it's located. So we need to be very, very specific. And so that takes practice, but that's what your ultimate goal is. It is imperative that you practice proofreading. Errors in a report, which are grammatical or typographical, can sometimes have important consequences down the road, and when things are typed in, they may mean something different, even if it is an error. So you want to double check your reports, triple check your reports for spelling errors, grammatical errors, errors in the weights and measurements where things may have not been recorded correctly or may have not been transcribed correctly, especially if you're using dictation, and anything that may have been omitted. My personal approach to these reports is I prefer that the new first year resident dictate the entirety of the report and then have a senior resident on the case. Their responsibility is to be an expert proofreader and correct these reports, so they should have very few errors by the time they reach my desk. Discrepancy is where many reports fall apart under the close scrutiny that you may face in court. If there is any discrepancy between a section of the report, this opens the door for an attorney to call into the question the accuracy of the remaining findings of your document, as well as your skills as a pathologist. This is not a comfortable place to be in, and I try to avoid this at all costs by proofreading my document many, many times. But, in general, as a resident, if you can present me with a document that does not have discrepancies, I will be very impressed. The places where discrepancies can arise are many, especially in an extremely long document with many sections that you work on over a long period of time. This is frequently driven by using templates, like I said previously. So if you're using a templated report where it has a normal description, so it says the cardiac valves are normal, thin, pliable, and the leaflets are soft and move with ease. So it has an extremely normal description. If you do not change that normal description to a pathologic description when you have a lesion, you may put in your summary diagnosis that the patient had mitral stenosis. But you cannot have a finding of mitral stenosis and forget to change that in the gross description in this template where you have all these normal findings. So if you're going to use a templated report that has normal findings, you have to change it when you have pathologic findings. It is imperative. Be thorough, be consistent. Update your gross exam and final diagnosis sections as you review the microscopic slides. So you're going to have to update things and change things as you go throughout this reporting process. And like I said, there must be agreement of all the objective findings in all sections of the report so that they all say the same thing and they all make sense. Because autopsy reports are not completed in one day, and sometimes they're pending for months until all these studies have been reported, it is very important to do that one final last edit to be sure that there is no discrepancy. Here's some important tips of things that I have seen done, but that really should never be done. Number 1, document exams that were not performed. Please do not document something that you did not do. If you did not examine a body part, such as the testicles, or such as the brain because there was a restriction, you need to document why it wasn't performed, such as there's family restrictions, or it was deemed not necessary by the pathologist, but never report something as normal that you have not examined. Never copy and paste the discharge death summary note as your clinical summary. Do not take something that the clinician has written and copy and paste it. There are many problems with that, but one of those things is that unfortunately, everyone is subject to this, but you may have disparaging remarks that are made about the clinical care of another physician within the institution or another service that was not the service that was writing the document, as well as they're going to make clinical judgments that you are not necessarily qualified to make that may be in those clinical notes. So you never want to copy and paste and use the discharge summary instead of writing your own summary. Also, do not use language that implies that you are evaluating or making opinion or an opinion comment regarding the quality or adequacy of medical therapy. Even things that you have frequently used as a medical student when you're writing clinical notes, such as using a phrase such as high quality CPR. I hear that frequently. You didn't perform the CPR, you weren't there when the CPR was being performed, you don't know if it was high quality or not. So you just want to stick to just the facts. What is it that was observed? What is it that was documented? And what happened? Always, here's some things you should always do. Tips of things that you should do to confirm accurate documentation and representation of the validity of your findings. The final report will stand for itself. However, if the available notes, body diagrams, and anything maintained in your case file, it may be subpoenaed into court into evidence. While there are different rules in every program and office about retention of records, I prefer to allow the final report to stand as itself as a complete report and do not necessarily maintain all diagrams or drawings once the report is completed. But you always want to review and edit your autopsy dictation and compare it with the notes that you took at the time of the case, as well as the body diagrams that we previously drew, and any photographs that have been taken during the case. I have frequently reviewed photographs at the time of sign out of autopsy cases and found things that were not documented anywhere in the report. So it's important to review those things before sign out and in addition to or while you're reviewing your reports. Also review the records of clinical testing or of clinical records and ancillary testing. You always want to follow the autopsy protocol format endorsed by your institution while you're in training. Follow your institutional rules and requirements regarding your storage and retention of notes, diagrams, and photos. Take separate photos without any identifying features. So if you're going to do a presentation or someone's asked you to present a grand rounds or another resident wants to write a case report from a different department, always take separate photos that do not include HIPAA information. So HIPAA information includes all of the things that I'm telling you were important for court documentation. So, data service is a HIPAA information. Name, case numbers, all of those things are HIPAA information. So you want to have clean photos if you know you're going to use it for educational purposes that do not include any identifying information. So I usually take double photos in most of my cases for that purpose specifically. You want to document any important information required for the American Board of Pathology to get credit towards your certification requirements as well. So you never want to forget about that. Always humanize the patient by referring to them by name in any appropriate section of the report. Anytime you're speaking about the patient, you want to try to use their name within the report. I always reference where I received clinical information. So if I'm writing my clinical summary, I include where it is that I've obtained this information. So was it coming from the Epic notes? Was it coming from your personal discussion with their physician? Was it coming with discussion with the family, the wife, the son, the daughter? Or did you get information from EMS reports? Include statements that are appropriate consent was obtained in hospital cases and specify any restrictions. So if you have a required consent, which most hospital cases have required consent, it needs to be specifically documented in the report that that was obtained before proceeding with the autopsy. Tips to learn autopsy reporting. One of my favorite tips is read as many autopsy reports as you can, written by as many different pathologists as possible. So many forensic cases, the autopsy reports are public information and you can gain access to them. They are released publicly and you can find them on many websites, especially celebrity deaths. You can see their autopsy reports are available on the internet. Read as many of these as you can to get information about how many different people like to phrase their reports. Be observant about the careful language that they have chosen. Think about why something may be phrased in a certain particular way as you're reading it. Expand your adjective vocabulary. Not everything is pink and tan, which is okay, and maybe when you're grossing little biopsies and when you're grossing, specimens. But in autopsies, there needs to be a lot of descriptive language. Ask for examples of reports written by the staff you're working with. So review reports by the particular staff that you're working with and try to emulate things that they have done in the past. And as you grow as a pathologist, you're going to develop your own preferred style of reporting as you gain experience, and be open to that and decide, what are the good things that you see in one person's report and what are the bad things, and remove those from your style and try to use what you think is best in your experience as you work with many different pathologists. If you're very interested, this is the recommended text that we use in our program. Our residents have access to a single copy for them to use during their rotation. It's a great, relatively inexpensive go-to reference when you have questions regarding medical devices or uncommon situations. And in the appendix, there are many sample autopsy reports with different forensic situations that you can read through, and gives you examples of how to phrase things or what's a good way to describe something. I found this book very helpful and have gained a lot of my information that I've presented here through my own experience, but also have incorporated many of the things from this book. So if you have any questions regarding this lecture, feel free to contact me on social media, or you can also contact us at our patholective.autopsy@gmail.com email address in order to have any questions. Thanks so much for your attention, and I hope you enjoyed this course.